treatment options for ankylosing spondylitis. Hi everyone, my name is Dr. Erin Carter. I'm a rheumatologist, and I made a video the other day about ankylosing spondylitis in terms of symptoms and how we diagnose it, and many of you requested a video on treatment, so here it is. I'm also again joined by my partners in crime. This is Finnegan, and he's here to help us too. Okay, back to the task at hand. When it comes to ankylosing spondylitis, we do recommend stretching and strengthening kind of exercise for everyone. The stretching is very important to try to keep the mobility in your spine so that you try to limit any fusion or lack of range of motion. And when it comes to pretty much any rheumatologic condition, we do try to recommend generally healthy eating as well. There isn't as much data when it comes to ankylosing spondylitis in terms of specific nutritional guidelines, but most of the data that we have tends to point to kind of a Mediterranean style diet. So lots of fish, nuts, seeds, vegetables, and basically trying to limit processed foods, sugars, especially refined sugars, alcohol. And now I often get asked about gluten, and I honestly find it very hit or miss person to person. Some people respond well to a gluten-free diet, other people it doesn't seem to make much of a difference. So it's not something I always recommend for everyone. But if people notice that their symptoms are worse after eating gluten or they want to try a gluten-free diet for a few months, I have no problem with them trying to go gluten-free. Then there are a few supplements that have been shown to be helpful, so fish oil or omega-3, as well as curcumin or turmeric. And while there's not a ton of data around this, it also looks like keeping your vitamin D level up is important for patients with ankylosing spondylitis. They seem to have better outcomes. So you may or may not need to supplement with vitamin D depending on where you live and where your level is. The studies so far tend to show that your level should be between kind of 100 and 150, depending on what units you're using. So that's the units we're using in my country, which is Canada, by the way. Sorry, I forgot to mention that. And now let's talk about medications. So the first line therapy are what are called anti-inflammatories or NSAIDs. These are things like naproxen or Celebrex. And people with more mild symptoms can just use them as needed, whereas people with more severe symptoms would typically try to use them daily. And then if these are not working, then we move on to what are called biologic medications. And these are medications that work more precisely on the immune system. So they aren't like chemotherapy, for example, that kind of lowers your whole immune system. These ones are targeting very specific pathways. And there are a number of different biologic options that we have for ankylosing spondylitis. The first category are anti-TNF biologics, and there are 5 of them in this category. So there is adalimumab, also known as Humira, although there are many biosimilars of this medication now as well, so kind of like a generic version. I think in Canada we have like 8 or 9 of them now, so different parts of the world will have different amounts of them. Then there is infliximab, also known as Remicade. Again, this one has a number of biosimilars as well. Etanercept, also known as Enbrel. Again, this one also has a number of biosimilars. Certolizumab, also known as Cimzia, and then golimumab, also known as Simponi. Then we have the IL-17 inhibitors, so secukinumab or Cosentyx, and ixekizumab, also known as Taltz. Whoever comes up with these names, I swear, it's ridiculous. And then lastly, the JAK inhibitors. So there's upadacitinib, which is Rinvoq,